All right, cool. I think we can get started here. So welcome everybody to Mental Health at the Crossroads, how New York's community barriers lead to family separation. My name is John Kelly. I am the co-executive director of Fostering Media Connections, which is a national nonprofit that uses the power of media and journalism to lead a conversation about children, youth, and families in America. If I could quickly just kind of plug what we do here, some of our kind of main programs. We have the Imprint, which is a daily news site covering youth justice, child welfare, youth homelessness, and kind of some of the major issues like mental health that spin around those systems. Fostering Families Today is our bi-monthly magazine that goes directly into the homes of about 30,000 caregivers in this country, foster parents and kinship caregivers. And then last but not least is our Youth Voices Rising program, which I am repping on my hooded sweatshirt here. Which is our terrific program to work with youth and young adults who have experienced both child welfare and the young adult, the youth justice system, to tell their story directly, whether that's through op-eds or narrative work or participating in events like this. If you would like to kind of get connected to what we do here at Fostering Media Connections, the easiest way to do that is really through our newsletters. So you'll see a couple of just quick links. I'm going to leave these up while I set the conversation up here. But we have, a weekly dose if you want that. Some regional stuff for folks in New York. We have a New York regional monthly newsletter, Youth Voices, and Fostering Families Today newsletters as well. So last year around this time, a national organization based in New York City called Children's Rights filed a lawsuit called CK v. Bassett. It's against the state of New York or some specific departments of the New York state government. And I'm just going to quote from the filing, a statement that I kind of think epitomizes sort of the gist of what was the point of the litigation. This action arises out of New York State's well-known and long-standing failure to provide Medicaid-eligible children with legally required mental health care. The named plaintiffs are Medicaid-eligible children with mental health conditions who require intense home and community-based mental health services in order to correct or ameliorate their conditions while remaining safely at home in their communities. So in other words, the allegation kind of at hand here is that New York is supposed to be providing mental health services to youth in their communities. It's getting money to do so. But the reality on the ground really does not match the obligations on paper. So we have this great group here to talk not only about the lawsuit in particular, but how the challenges that New York faces in terms of community mental health impact two systems that I already kind of pointed out are a big focal point for us here at Fostering Media Connections, and that is the child welfare and youth justice system. So let me get started by kind of giving these guys a chance to introduce themselves, our panel today. And right before I do that, I just want to thank the Tao Foundation, who has generously supported us to cover youth justice in particular in the state of New York for many years and has enabled us to do events like this. So with all of that said, let's start having these guys tell you a little bit about themselves. I'll start with you, Sandy. Go ahead.
Hello, good afternoon, everyone. My name is Sandy Santana. I'm the Executive Director of Children's Rights. And Children's Rights is a national organization that uses strategic advocacy and impact litigation to protect kids in child welfare, juvenile legal, immigration, and healthcare systems. And we have been working throughout the country with advocates to end the unnecessary separation of children from their families, particularly Black children, and also to end the institutionalization of children in this country.
All right, Amal, you're up.
Hi, my name is Amal Karufi. I'm a youth action researcher with Youth Empowerment Transforming Care at the Children's Defense Fund New York. I joined the organization in May 2022 to help shape the research and organizing around transition age youth with foster care experience in New York City. My work includes developing research around the experiences of those who have aged out of care. And through this work, we have created the first direct cash transfer, better known as guaranteed income, for young people who've aged out of care in New York City.
Very cool. Last but not least, Jose Perez, who is on mute.
Thank you.
Somebody.
Yeah, it's always somebody. It's always me too. Thank you for having me. My name is Jose Perez, and I'm the project manager here at the Children's Defense Fund New York, working as a project manager for the Youth Empowered Transforming Care project that Amal just explained. And I also come to this work as a lived experience professional in the child welfare system. And I also am working toward just raising awareness of the intersection between of the child welfare system and other systems of oppression where teenagers and children just don't belong. And I'm here so excited to be on this panel and talking about a very, very important topic.
We appreciate you all being here, and I want to compliment Jose on a very slick move to wait. I'm a lifelong Red Sox fan, so it was a nice slick move to wait until the very last minute to throw that Yankee Supreme on, because I would have put my foot down on that one. Okay, we're gonna start with Sandy in a minute, who's gonna start talking about kind of the litigation, how it started, what they're seeking, all of that. I think there's a couple of kind of key terms I just want to make sure. I don't want to assume that people know all the jargon around the mental health service community before we get started. I think most people know what Medicaid is or have heard of that. That is a national public health insurance program that covers about 1 in 5 Americans, including many, many children in this country. There are some requirements to Medicaid, right? It is something that is paid for in partnership between the federal government and states. There are certain things that states have to put into their Medicaid plans and offer to people, but there are also variations. Some states are significantly more generous or offer more things than other states. So when you look at it, not that you ever would, but if you compare a Medicaid plan from one state to another, they can be quite different in different places. EPSDT is not one of those things that can vary from state to state. At least on paper, you are required to provide it, and it stands for early and periodic screening, diagnostic, and treatment. That means that your Medicaid plan, you have to be assessing children's health early on. You have to be doing regular checkups. You have to screen, diagnose, and treat significant issues. And those issues are not just physical, that includes mental health. And the last one before we move over to Sandy is home and community-based services, HCBS. Now, this is to some extent optional. There are waivers that states attain to receive federal dollars to help pay for home and community-based services, but all states use this to some extent, some more than others, and it's meant to prevent specifically institutionalization for people with serious health needs, whether those are physical or mental. And I think one key thing that's going to play into our discussion here is that nationwide, we're talking about New York today, but nationwide, the demand for home and community-based services dramatically outstrips the supply. So this is according to the Kaiser Family Foundation. There's about 820,000 people on a wait list for home and community-based services. The average wait on that list is 3.5 years. So just imagine if you had a serious need, or your loved one or your child had a particular serious need, and the services that could keep them from being institutionalized were out there, but you had to wait 3 years. Imagine what could happen in 3 years. So with all that as kind of preface, let's go to you, Sandy, and talk about what New York, which is a user of HCBS, says that it is doing in terms of community-based services.
Thanks, John. Well, let me just start by saying that actually the EPSDT provisions of the Medicaid Act actually require, and the operative term is require, states to provide certain intensive home and community-based services, mental health services. And that's for Medicaid eligible children for whom such services are deemed medically necessary. And there are 3 buckets of those required services. The first one is intensive home-based behavioral services, which is really individualized therapeutic interventions that are frequent, consistent, delivered in the child's home or wherever the child happens to be naturally located. The second bucket is something called intensive care coordination. And that's an assessment and service planning process conducted through a child and family team. And really what that means is people who know the child, providers who work with the child across systems, maybe teachers, maybe friends are part of this child and family team. And they coordinate services across multiple systems. All these kids are involved in not just the mental health system, but other systems as well, that serve child and the family and monitor progress along the way. Just to give you an example of what that looks like, the coordinator provides assistance in helping family navigate these very complex services and all the requirements related to those services. The coordinator is an advocate for the child and the family to make sure the child and the family are actually getting the services that they need. Another sort of bucket of these services is the mobile crisis services. And these are intervention services that are meant to respond quickly when there are acute mental health crises. And they're supposed to respond wherever needed quickly, and they're an alternative to law enforcement. So these are the three buckets that New York is required to provide, right? Without these home and community-based mental health services, children are stuck in a vicious cycle of repeated emergency room visits, segregation in residential treatment facilities, psychiatric hospitals, and other institutional settings. Then they're released from these settings, but they're discharged with no follow-up at all. And predictably, what happens is the mental health conditions continue to deteriorate. And some children just go from crisis to crisis, and this cycle repeats itself. And when there's an acute mental health crisis, sometimes you see self-harm or ideation of suicide. And that crisis is met with a law enforcement response, which for young people can be perilous, particularly for young people of color. I should note that this vicious cycle disproportionately affects LGBTQ youth, children living in low-income communities, and children of color. So let me tell you a little bit about how this cycle played out for our 15-year-old plaintiff, CK. So CK was first hospitalized at the age of 4. He had 16 hospital stays from age 4 to 10, including a stint at a residential treatment center. From age 10 to 12, he spent those 2 years separated from his family in an RTC. Imagine being isolated from your family at the age of 10 through 12. From age 12 to 15, he was hospitalized several times. He spent 3 months at a residential facility. He was hospitalized in an inpatient hospital for 2 weeks, partially hospitalized for another 2 weeks, and recently attempted suicide and was hospitalized again. So you can see how this vicious cycle plays out in CK's life. And that's true for thousands and thousands of children in New York State right now. So the professional literature is really clear about the benefits of intensive home and community-based services. And regulatory guidance from the DOJ and CMS is also clear. Children do better when they receive these services. And this is what the DOJ and CMS has found. Children experience improved clinical and functional outcomes. They have more stable living situations. They maintain connections to families and communities. You see significant improvements in the quality of life. There's fewer suicide attempts, and they perform better in school. And one thing not mentioned here, but the costs are less. The long-term costs of providing these services versus the cost of institutionalizing children are vastly different. It's much cheaper to provide these services early on. So what happens when kids don't get IHCBS? The professional literature is also clear that without these services, children do worse. They're unnecessarily separated from their families and segregated in institutions. Their conditions deteriorate. And when the crisis response is law enforcement, they often end up in the criminal legal system as well, instead of getting the treatment that they deserve and need. So that's the reason why we brought this lawsuit. These services are critical for Medicaid eligible children in New York.
Right. So just to sum up, and then we'll get back to you, Sandy. You know, the research has clearly shown the value of what like community-based services can do as compared to more intense things where you're ending up in an institution, whether you're in residential or incarcerated, obviously. New York is saying, or their plan is involving, you know, coordination of therapeutic services that they have, and that there's also to the side of that, a mobile response for things that come up more acutely. So that is sort of a description of what should be, perhaps, right? And what the research shows about the value of that. What is actually going on in New York in terms of—
on paper, that's right. They purport to include some intensive home and community-based services in New York. The reality is that vital services are not included. I'll give you an example. New York has health homes, which are meant to provide those intensive care coordination services that I described before, those child and family teams. The reality is that those are just referral services. And the irony is that the state is referring families to services that don't exist or for which there are long waits. And there is no meaningful implementation of mobile crisis services in New York at all. So to the extent that New York is providing some services, they're fragmented, uncoordinated. Desperate families are left to cobble together mental health care on their own. That's the situation in New York. There are huge shortages of trained professionals, which leads to long waits for family to get even those limited services. In fact, the wait can be a year or more just to get very limited services that aren't in reality the services that EPSDT provisions contemplate, the intensive home community-based services, those three buckets that I described before. And you don't have to read our complaint to get an idea of the scope of the problem in New York. The fact is that the state has been cataloging these problems for over a decade. You can read their own documents and see the problems because they acknowledge them all throughout. So just to give you an example, there are 1 in 10 youth have a serious emotional disturbance in New York, but only 20% of them are getting the specialty treatment they need. So let me give you another example. New York purports to have this children and family treatment support service, which is really the home-based intensive therapeutic services that I described before, that first bucket, right? Only 8% of the 200,000 eligible kids for that service are actually getting that service in New York. So if I had to summarize, John, it's a really dysfunctional system that is really dystopian for families to try to navigate, that is not really meeting the needs of kids.
Okay, so it's been about a year, which is kind of crazy to me as I was kind of prepping for this event, that it's been a year since you guys put this into motion. Mm-hmm. There was a big story about it right when it came out. I think we talked about it on our news podcast. At the time, the state had no comment because it's pending litigation, and they always say that. But I'm curious, and not to put you on the spot, but can you generally describe kind of where things have gone since you actually filed this? Like, have you had conversations with the state? What's the latest?
Yeah, we can't get into that. All I can say is that it's following the normal course of litigation, and we're ready to go all the way to trial to try the case.
Okay, so I'll do it as a hypothetical so that you can probably answer a little more freely. Let's say the state called you after this event, man, that would be great for me, and said, we want to work with you. We know this is a challenge. What do you envision with the caveat that this will not be your job? I mean, your guys' job is to litigate this and bring it to light and seek relief. But what do you imagine that the relief is? Like, what does the state need in order to be successful? Because I doubt they're intentionally being in short supply at the very least on community mental health. What do they need to do to get to where you would think they need to be?
Yeah, I would say that the major barrier to providing these services has been a lack of investment in staffing over decades. There are just not enough practitioners to provide these services. So kids are not getting what they need and when they need it. So the first element of anything the state needs to do is to really improve that provider capacity, to have the capacity to invest the dollars necessary to have the number of practitioners necessary to deliver these services to kids. A second prompt, I would say, is to involve young people, particularly people who've been disproportionately affected, LGBTQ youth of color, to help design better intensive home and community-based services. That's essential because there's a mismatch between what the state says it's providing and says what families need and what families are actually experiencing on the ground. And then the third thing is we need the state to be transparent, to collect data and provide it to the public so that we can see whether the state is actually progressing, whether the system is improving, and so that not just children's rights, but the public as a whole can hold the state accountable.
And was that something that you guys even have difficulty doing in kind of prepping for this? I mean, was it hard for you to ascertain, the numbers around what is actually happening?
Yes, and I think part of the good thing about a lawsuit is you have access to discovery, and you can get some documents that aren't necessarily in the public sphere, and you can get more background on what is actually happening. But there are reports from 2011, reports from 2015, reports from 2021, 22 that catalog all the systemic deficiencies, and these are reports from the state. So let me just give you one data point real quickly, and then I'll end. The average time between onset of symptoms for a child and the actual treatment in New York is 9 years. So if you wait too long to provide those services, if you don't intervene early enough, the mental health conditions spiral out of control, and it becomes that much more difficult to provide these services in the way that kids need.
Yeah, for sure. All right. Amal, let's talk about how what we've been discussing, right? The provision of community mental health services in general connects to a field that you have particular good working knowledge of as a researcher, and that is child welfare. I mean, what does mental health, in your experience here, look like in this system in New York? Are youth able to access what they need, or does this sort of resonate hearing Sandy kind of lay out the litigation and what's involved with it? What do you think?
I mean, speaking from my own experience and looking at the data, young people aren't really getting what they need. And just to kind of paint a mental picture, right? In New York, 2022 survey was done for youth in foster care between the ages of 13 and older, and 30% of people who identified as male and 40% who people who identify as female were reported feeling down, depressed, and hopeless within the last 2 weeks. And I found that nationally, up to 80% of young people who have experienced foster care live with significant mental health needs. This is an urgent problem because while mental health is always important, mental stability and wellness in adolescent years is critical to the overall development and their eventual ability to navigate the adult world. And according to the U.S. Surgeon General, the pandemic has significantly worsened the mental health crisis for many adolescents and young adults across the U.S., including those who live in foster care. And based off what I see here in New York, some of the biggest challenges are getting community-based care versus having to go to a hospital and getting constant services from the same person in a way that doesn't feel cookie cutter.
Right. So that's like an issue not only for, so one thing that you run the risk of if you do not have this kind of array of community-based mental health services is that youth could end up in foster care. Mm-hmm. Right? Like we've actually seen that in other states, and that's why, I hope folks that are not in New York listen to this, because this is certainly, I mean, this litigation is about New York. You guys are in New York, so we're getting that perspective, but it really is kind of a nationwide problem. Just as an offhand example that I know from our work, Ohio basically a couple of years ago conceded. We're basically telling some parents who have young people deeply in pain, struggling with mental illness, put those kids in foster care. It's the only way that we're going to be able to pay for them. But if I'm hearing you right, it's also the case that once youth are in foster care, the only way sometimes that they're being able to access mental health is by going to a hospital and getting essentially put somewhere to get it, right? Not in their foster home.
Yeah.
Yeah. Same basic question for you, Jose. You have a particular knowledge of the youth justice system there through your work. What does that look like on the juvenile justice and the youth justice side in terms of how, access to mental health services impacts system involvement, incarceration, and all that?
Thank you, John.
Sure.
And thank you, Sandy, and thank you, Amal, for sharing your experiences. First, I want to talk about how I see young people's mental health and the way it intersects with their experience of trauma in the child welfare system and the youth justice system. When a young person first encounters the child welfare system, this person has experienced some kind of trauma. And we know these traumas. The problem is that we don't begin to address that trauma until this young person exhibits some behavioral issue. And adults seem to be concerned with control as opposed to healing. And this is an especially important issue in the context of transition age youth, where young adults who are leaving foster care at 18 or older are entering adult systems that are not usually tailored to their age and stage in life. We have arrived at a moment where we are expecting our teenagers to be in a better position than when they were when we were teens, all the while giving them less resources. So the consequences of unmet mental health needs are dire for young adults leaving the foster care, because unmet mental health needs are aligned with causing homelessness, disconnection from school and work, and contact with the adult criminal legal system. In New York State, only 1/3 of young people who age out of foster care were enrolled in school at age 21. And 1 in 5 youth aging out of foster care in New York has experienced homelessness within the last 2 years. Youth in foster care group homes are 2.5 times more likely to become involved in the justice system than youth placed with foster families. More than 90% of youth in foster care with 5 or more moves will become involved in the juvenile justice system. And another study found that by age 17, over half of youth in foster care experienced an arrest, conviction, or an overnight stay in a correctional facility. My previous work at Cases, right, offered me a glimpse into how we are constantly demeaning and undermining the humanity of teenagers who are more vulnerable than others.
Can you, I don't want to get you off a roll right now, but can you tell folks a little bit about what Cases is so they know?
Yeah, absolutely. That was my next thing.
Sorry, so, go ahead, man.
Cases is called the Center for Alternative Sentencing and Employment Services, and within that company, I served as a worksite supervisor for gang-involved teenagers from 18 to 24 in East Harlem, participating in an amazing program called ACEs, which stood for Assertive Community Engagement and Success. I have personally witnessed like the bias against teens with certain certain backgrounds that almost always pointed to their mental health needs not being met. For example, right, I began my shift one day after a participant was going to be sent home because he refused to work. Before it was decided to send him home for the day, I was able to have a conversation with him. I knew that I could talk to him and find out what was really going on. I was assuming, like everyone else, that he was being difficult, right? Sometimes teenagers are difficult, right? So I had a conversation with this young fella, and he revealed to me that he hasn't had any access to any running water for a few days now. His father was giving him a hard time about school, among other things, and he had been brushing his teeth with water bottles from the store, and he didn't want to talk to anyone. He didn't say anything, but I can gather that if it was me, I wouldn't want to talk to anyone, nor have the capacity to speak to anyone if I was going through something like that. As an adult, if I didn't have access to running water for days on end, I would not be in a good mood. Imagine a teenager. I think we are all human beings. I think we have to ask ourselves, how am I contributing to the harmful practices that make vulnerable populations even more vulnerable and less safe to speak up for themselves in our community? And how can I be of better service to teenagers aging out of foster care so that we can remove the punitive element of care and incorporate an element of healing within our journey toward healing practices, right? So my current work at the Children's Defense Fund New York, where I serve as the project manager, as I explained earlier, I'm able to work on the how. So as CDF, I get to work for my former 18 to 22-year-old self, where I can begin to answer the questions and follow through on them. We have learned through data and through personal experience that many young people don't have their mental health needs met until they fail up deeper into systems like our juvenile detention and adult systems. They end up getting treatment when they are in custody, when they should have gotten support in the community when the trauma occurred, right? I experienced 7 different homes, 3 drug rehabilitation stints. I was in the boat when I was 13 years old. I spent time in the New Sparkford at the time, today known as Crossroads and Horizons. From the ages from 3 to 16, I was in foster care before I committed a crime that caused me to go away for 20 years to life. By the grace of whoever is in charge, I was able to engage in my own sense of healing. But that's not the norm. That's not what happens. This speaks to the idea that I always knew what I needed to help me heal. I just needed someone smart enough and also caring and loving enough to listen to my voice.
There couldn't really be a better transition to what I want to ask the two of you now than what Jose just said. And then also Julia Schulman, who was in the chat here, made another comment that kind of made me think of the same thing. Her kind of observation here is that too often kind of we view mental health and the test of whether it's working or not as, are people able to survive without being, too dysregulated or too much of a deviant? I'm just reading from her. These are her words. And that shouldn't be the goal. The goal should be actual happiness and self-fulfillment. So to that end, I think what Sandy and Children's Rights is pursuing is some guarantee that the basics of mental health services on a clinical level, right, therapeutic strategies is available to parents and the kids who want and need those. But we know that mental health and community in the community is much more than just those therapies. So, you know, Amal and Sandy, I'll let you weigh in on this too. I'm sure you have thoughts, but you know, Jose and Amal, like what beyond therapy would you guys say are the things that young people in your orbit that you guys work with and research and survey and all that want the most that are not there? What do they want in their community that would improve their mental well-being? Wait, pick one of you to go first. I'll pick.
I could go. I could go more if you like. So I think that we are often thinking in silos, right? Like we are often thinking in silos. When I say we, I'm referring to you and I and people in it and that are not here. You know, we think in either or categories: the mental health or child welfare or criminal justice or housing. But the reality is that many young people, including those in our Youth in Power project, have experienced all of these systems, right? The child welfare system not only intersects into other spaces, they have direct lines as a consequence to systems where they may have experienced further harm, right? So where their mental health and well-being breaks down, the consequences are written all over their lives. So it is important to remember that with these groups of young people who have contact with the criminal, legal, or the child welfare system, mental health treatment and medication can be used as a punitive and controlling way, especially how we often see young people incapacitated with psychotropic meds and creative punishments. You know, we need to think about services that support and reinforce well-being before young people are in crisis or immediately after a traumatic event. You know, what I'm not saying is that we have a way to prevent trauma from occurring. And what I am saying is that we should have a trauma-informed care approach to connecting with solutions, to not be reactive and be proactive. We can accomplish this with mentoring, peer support, mindfulness, and connecting to community resources appropriate for our young people. And the appropriate services are those that are informed. The appropriate services are those that are informed by or created by those who have been harmed. That is our young people having their voices heard. These are softer supports, not necessarily clinical ones. They are about maintaining well-being with others. We also need to make sure that young people can build consistent relationships with caregivers. Turnover among mental health providers, changes in staff that undermines the relationship that young people need to build with the professionals that are there to help. We need a workforce that looks like us and is compensated well so that they can stay in this work. We need to meet people where they are, and that means more mental health supports in schools and other trusted community-based organizations that young people rely on in their neighborhoods.
Mal, you want to weigh in on that at all?
Yeah. Overall, I think we need to think about the day-to-day support that young people need, and not just the mental health care provided in clinics, hospitals, or therapy sessions. And we really need to address the overuse of psychotropic medications among. Yeah. We need to address the overuse of those medications among youth and build policies that interrupt the knee-jerk reaction to medicate behavior. I believe that the way to get there is to require those who are running these systems to seek and incorporate input from youth and young adults who have experience in foster care about what approaches work and which do not, with regard to their healing and mental health needs. And that means collecting feedback from youth directly and including the services they want and the providers they trust. This means working with young people like me to review policies and help develop new ways of supporting their well-being. This work must be pursued in partnership with youth and be led by people with lived experience. Right. And it has been proven that when agencies integrate youth and young adults' perspectives into child welfare policy decisions, the resulting programs and services are more effective to build strength, resilience, and trust among young people they serve.
That was really well said. And I want to also recommend to people, Amal wrote a really beautiful opinion piece for us here at the Imprint about this issue. I'm gonna on the fly my webinar producer Sarah go find Amal's op-ed and throw that in the links for people. But she really hit this on the head. So we're talking about, again, you know, a New York issue, a New York lawsuit. There is a just for broader context, there was a piece of legislation that was passed in Washington, D.C. called the Bipartisan Safer Communities Act, which was in response to another horrific spate of mass shootings, including the one in Uvalde, Texas. And I don't want to embarrass them all and just praise her for too long, but I'm just going to read a piece of hers, and then we'll get it into the link. Oh, Sarah, you're so fast. She already got it in there. These increases, she's referring to the amount of the very large amount of money that is about to come down or has already come down to some extent to states around the country to do better, to do more mental health services with youth. And she writes, these increases mean that those with lived experience within child welfare, all who have experienced trauma, will finally have the chance to get the care they need. But doing it right requires the Biden administration to ensure that its demonstrated commitment to working with impacted young people as part of the rulemaking process for this law that will shape changes in our community. And should go click that link and read the rest of it. But Sandy, there's a similar component or ask, right, as far as the litigation that you guys are pursuing with New York.
Yeah, I mean, I think I talked to, I gave you a bunch of acronyms, and the discussion seemed a little bit clinical, but the reality is that we see this as a social justice issue. There's a mental health crisis in this country. Families of all stripes are facing them, but the resources to cope are not the same. And the ability of low-income families, LGBTQ families, families of color, to access some of the services that middle-class and upper-middle-class families can access is not there. So this is a social justice issue, deeply rooted in the inequities in our society, and we see it that way, first and foremost. The other thing I would say is that it's important not just to have people with lived experience be part of this, but be representative in who those people are. Because again, this isn't impacting everyone the same way. I'll just give you a few stats real quickly. LGBTQ plus youth consider suicide at 3 times the rate of non-LGBTQ peers. African-American kids ages 5 to 12 are dying by suicide at twice the rate of white counterparts. And the CDC just recently found that Black high schoolers, and this is in New York, Black high schoolers in New York are 2 times as likely as white peers to engage in suicide attempts that involve injury, poisoning, or overdose. So that's the situation. So we, if we had our druthers, and obviously every lawsuit, if it comes to settlement, there are negotiations back and forth, et cetera. But we would want to make sure that the state it deeply involves people with lived experience and is representative in who they're involving in shaping these various policies and services that are not being felt the same way by people in our communities.
All right. So we still have some time left here, and I have a few questions I want to throw at these guys, but we are certainly happy to entertain some questions from folks in the chat here. So if you have some questions, write them down. There's more of an observation in here, but not a question, but I'll throw this out there for you. Christina Richberg writes, I totally agree. I'm assuming with everything everybody's talking about, but we don't really have the capacity to provide all the services that are really needed to address youth's behavioral health needs, especially post-COVID. And I think that gets to, I guess, what I asked you, Sandy, right? It's like, you can't just you can't just sue a state and they say, you got me, and then immediately fix it. There's going to be some steps along the way.
Yeah.
Money is obviously a thing. You can't build out more services without the money that you need to pay good qualified people to do them, whatever they are, clinical or otherwise. But it's got to be more than that, right? I mean, there's got to be other things that New York has to consider here.
Yeah, I mean, I would say though, John, that it's yes, money is an issue, but it's been a failure of political will. What we've found so far is that there's a deep underinvestment, just financially, in these services, and that the state has been over time deliberately indifferent to providing those services when it itself says and knows that they're not spending enough to provide the types of services that are actually legally required, as opposed to the concoction of services that are inadequate that they're providing right now. So resources are important. The second piece is really making sure that the services that are provided actually meet the real needs of children and families. That would be the second piece. And then the third piece is to make sure that all these services are coordinated. There's no value for families to try to cobble together one service here, one service there, and try to pull it together, when in reality what's needed, it's a complex system, and what families need is real help to try to coordinate these services. And that's not the case in New York, even though the state will tell you they have intensive care coordination services. In reality, those services aren't there.
Yeah. So I'm gonna stick with Sandy to get the context from the lawsuit on this one, but this is something I want to hear. Jose and Amal have already raised this as an issue, so we'll definitely get them in here too. So Sandy, where do psychotropic medications fit into everything with you guys? Obviously, that is a big part of the mental health treatment continuum. Research clearly shows that it's, at least in many places, overused with youth in foster care. The filing makes clear that, once your clients were institutionalized in this lawsuit, they were put on lots of drugs. But what did your in prepping for this lawsuit and getting the facts on the ground, what is your sense of how psychotropics are or not used for good or bad in the community continuum that New York does have now?
Yeah, I mean, I think there's a lot more for us to unearth there, but the reality that because there's a lack of, as Jose said, there's a lack of trauma-informed mental health services in the state, psychotropic drugs become a default chemical straitjacket to deal with behavior that are symptomatic of mental health needs. And so in lieu of actually providing the deep mental health support that kids need, psychotropic medications become the best solution at that point. And it's incredibly dangerous because these drugs have not been necessarily tested on kids. There's a concept of polypharmacy. So a lot of these kids are actually on 4 or 5 different medications that counteract with each other and have very grave symptoms. So the reality is, when there's an absence in therapeutic interventions, the psychotropic medication solution becomes the most obvious one and the most accessible one. And so there are kids that we know in the child welfare setting and the community setting that would do just fine without psychotropic medication if they only had access to the trauma-informed care they need. Yeah.
Amal, does that resonate? I mean, you kind of alluded to it earlier, but we have even in New York City, where there's a lot of attention on it, there's a lot of heavy reliance on psychotropic meds for youth in the system.
I mean, yeah, I feel like it's always the solution to all their problems. I'm too hyperactive, so I'm going to over-medicate you. And I mean, speaking from personal experience, I was on like 6 different medications, and it's not like they were like 20 milligrams, they were high doses. And then, I mean, as these youth get older, they like to take you off cold turkey from all the medications you were just on, and then kind of just expect you to handle all that. And no one really realizes that there's a huge reaction to when you do that to somebody, especially at such a young age.
Yeah, that's insane to make somebody come off 1, let alone 6. I
just wanted to add real quickly, if one thing I didn't mention, and for people who are actually reading the complaint, if you read the number of medications that our named plaintiffs are on, it gives you a deep sense of the problem. 6, 7, 8 over time with names that are very hard to pronounce. It's a real issue for sure.
Amal, when you say you had at one point 6 different prescriptions for these drugs, this is something that comes up in this litigation. The idea not only of providing therapy but coordinating it. Is your kind of recollection of that there was actually somebody who was in charge of deciding what you got, or was it more piecemeal? Like somebody put you on this, and then another person put you on this 3 months later, not really confirming. Like, what was your experience with that?
Yeah, the second part, more
Yeah.
like I was already on like 2 other medications, and then like I would go somewhere else, and it's like, okay, we're just gonna give you these 2 also. You know, you should be fine. It's okay.
And never take you off another one. Like,
No.
just keep at it.
No.
Yeah. Jose, thoughts?
It's sad. I mean, I think about it and it's like, Amal didn't deserve to be treated that way.
Yeah.
Period. We act as if we don't remember how we were when we were children or when we were teenagers, how difficult we were. And it's just saddening that no one really, was able to just speak up for Amal, right? But now I think that's different now. Now Amal gets to speak up for herself. And I think that's something that we need. And we need the safe space for us to be able to speak our minds and speak how we want to be treated and then people be responsive to that. Because I mean, I experienced something similar to what Amal experienced when I was a kid. And, it took for me to go, when I moved to Puerto Rico, when my family in Puerto Rico seen that I was on psychotropic meds, culturally, Latinos, they're like, yo, what? Medication? No, you get this chancleta. That's what you're going to get. So they took me off the meds and gave me a chancleta. But at the same time, that's another form of neglect and abuse, right? Like culturally, we also have a disconnect within our communities where people are being taken from, uprooted from an environment where they were used to living this way. And then they go to another environment and they're like, wait a minute. You're not supposed to be acting like that in my household. But they didn't know that this person you might think this person is hyperactive, but that person might be listening to music in his head. Salsa, merengue, like you might think that's something that might be culturally sound to you. You person needs to be outdoors as opposed to indoors, right? Like that is just the truth. Some children like to be indoors, some children like to be outdoors. But you want the child to be indoors, so you're gonna pop some psychotropic meds and incapacitate a child so that you can control.
Yeah, and I think, when I think of the best case scenario for New York maybe coming to the table and addressing the shortcomings that are identified in this litigation, it looks like really having a spirited, intense conversation with young people and with older people who were young people in these systems and who experience mental health, institutionalization, or foster care, incarceration, about what needs to be provided, that therapies, good evidence-based ones, are on the table. But Sandy, I feel like the worst case scenario is we dramatically lower our use of institutionalization and family separation by just ratcheting up the amount of psychotropic meds that we use to keep kids, tranquil in their homes, right? That's got to be a worry, that slippery slope.
Yeah. And there's the evidence is in on the lack of oversight of psychotropic medication and what it can do. We have, at this point, we've sued 3 states because they have had lack of oversight over the administration of these drugs. These are in child welfare systems. We know that in the long term, for many, many kids, and this is the crux of the lawsuit, for the named plaintiffs and many of the kids, thousands of kids in New York, they can be in their homes, with their families, with their communities, with their friends, getting the type of therapeutic interventions they need. And some of them may need some psychotropic medication, but at least it will be with informed consent with the doctor as part of a process that also includes therapeutic interventions. The problem is that when those therapeutic interventions aren't there, the psychotropic medication becomes a standalone mental health intervention. And that's incredibly, incredibly dangerous for young people.
Yeah, for sure. And it's solvable. You know, there are states that have figured this out, often through the experience of tragedy. I remember Florida, you know, had a foster youth who took his own life after being prescribed at an extremely young age, heavy antipsychotic medications. And, you know, they, for all their other challenges in Florida, did seem to put together a process for actually reviewing this stuff. Last question from me. And again, if anybody wants to ask a question in the chat, feel free to put it in there. The issue of waiting lists comes up a lot in the litigation, Sandy. And I guess for anybody here, but you know, Sandy, you might know the most about Medicaid law before us. I sure don't. Do you think there is an appropriate way within the law to ensure that youth in crisis, particularly those who are either in foster care or involved with systems already, can have the ability to skip the line and get on top of waiting lists? Like, I don't know how else to ask that other than to say, you know, in the best case scenario, again, of fixing the community mental health system for kids in New York, it will not happen overnight. There will be waiting lists for a long time. In your mind, is it appropriate or legal to just figure out ways where young people in crisis get to the head of the line?
Well, let me just say that the law is clear. There's something called the reasonable promptness provision of the Social Security Act, which actually says that kids need to get these services reasonably promptly. When you're talking about years-long wait lists, that's not reasonably prompt. And so New York and many other states are out of line with what the law actually requires right now. So whether we can triage and skip some kids with acute mental health needs to the front of the line, that can definitely be done for sure. But the bigger issue is that New York is knowingly violating the law by not providing these services on a timely basis. And if that requires an expansion of provider capacity to do that, that's what the law requires, and it needs to be done. And so that's what Children's Rights is seeking to compel, that the states actually make those investments so that kids get services with the required frequency, duration, scope, and also on a timely basis.
Right. We have Elena Robbins in the chat making a comment that New York did have a priority process for services for foster care youth called Bridges to Health, but it was discontinued and now is routed through health homes. That anybody had experience with health homes?
I haven't had experience, but one of the things that runs
they're not doing much yet.
Yeah, one of the things that runs through the lawsuit is that it's not actually the intensive care coordination that you would envision. It's not actually getting families to the services that they need. It's a referral services. It's you should get this service, and then when families go and try to get these services, they're unavailable, or they're told you have to wait X number of months to get them, or years.
Yeah. All right. Well, I think we can actually wrap up a little early. We don't have any more comments or questions in the chat, but I thank everybody here for attending and checking us out on a Monday. I know that's kind of an odd day to do a web discussion, but it worked for everybody here. And I think this is a really good one. We'll be sending this out, and it'll be live on our YouTube page, and we'll put it out on our podcast feed. So this will reach everybody at some point that needs to hear it, spread it wide for us. So for Fostering Media Connections, I want to thank Sandy and Amal and Jose for being here today with us and really talking this through. And again, check back with us on the on Fostering Media Connections through our newsletters. We will certainly be covering this litigation and the issues around community mental health, foster care, and juvenile justice in New York. So with that, I will thank everybody for attending, and thank you guys for the great discussion.
Thank you.